So the challenges of good sexual health in terms of people living with HIV, I think firstly it's to have a broad view of what sexual health is. So it isn't just, I think people assume it's all about preventing or treating sexually transmitted infections, and it's so much more than that. It should be about people being able to have the sex that they want and to be able to enjoy it at whatever stage in life they are at.
I think the challenges are wide and quite varied. There could be cultural barriers, for example, not being able to actually even talk about sex and sexual health and what that actually means.
Are they having the sex that they want is a question I often bring into it. And it comes up a lot with women about having sex sort of not necessarily forced upon them, but having sex that they don't necessarily want to keep their partner happy. So we explore all of those different thoughts before I talk about sexual health often, because as HIV positive people, a lot of the focus is always on the health side of it.
As a gay man, I know how it's been for me in the past, where you used to go in for your checkup and they would ask you how many partners you've had in the last 3 months. And there you are kind of counting, and as you know, sometimes it's a number that you may not feel entirely comfortable writing down. And this is despite the fact that it's a sexual health clinic, and that the doctors and nurses deal with this every day. They're used to people with multiple sexual partners, but there's that issue of stigma around sex and sexuality. And it's something that we all have to deal with, just in trying to make it a normal conversation, I think.
There's also understanding that sexual pleasure isn't always necessarily penetration or heterosexual sex. There are different ways and different approaches, and it's unpacking that.
Do you find that perspective, from a peer perspective then, is helpful in relation to breaking down some of those barriers and getting people to engage with that conversation a bit more easily?
So by sharing my experiences about getting a sexual health screening with the people I'm mentoring, definitely helps break down those barriers about going to get one themselves. How often I did it, whether when I was having casual partners, when I was in a long-term relationship, and what is to be expected from a screening as well, what type of things they'll do, what type of swabs they'll do. So in our service, we can signpost people if they've, say, experienced sexual trauma. Our clinic has a psychotherapist who can help with that. There are other services across the city to help women specifically process things like domestic abuse and consent in relationships, and then sexual trauma as well.
I also love the menopause brochure from Sophia Forum, which is fabulous and gives information that I never even knew about menopause.
There are many ways we can look after our overall health and well-being to live well with HIV today. To find out more, visit the Find Your 4 website.